Now, hopefully you've had a chance to get your coffee and come back to us so we can continue to teach about bradycardia. I want you to remember that, again, bradycardia may be benign, like I said, with athletes. But if it is concerning, you have to consider all of the reasons why a patient might have a bradycardia. And certainly that would play a factor into what you do for it, right? I mean, like if you work in neuro and you're in the ICU, well then if your patient has a bradycardia, you better be thinking high ICP, you know, Cushing's triad. If you are in the emergency room and a patient comes in, it's the middle of winter, it's below 0, well then maybe your patient has hypothermia. Also, if they've had a drowning accident, being under cool water will also cause that bradycardia, as you know. Maybe they're the opposite of me. You know that I have hyperthyroidism, and that's called Graves' disease. But what about Hashimoto's, the opposite, or hypothyroid? You have to consider all of these things. Maybe it's an electrolyte issue. Maybe the calcium is too high. Perhaps it is a medication reaction. I mean, come on now, we have a lot of polypharmacy going on, and with that comes a lot of side effects. So perhaps that bradycardia is related to a blocker. What kind of blocker, Shelly? Oh, any blocker will do it, but specifically beta blockers and calcium channel blockers. If you have patients that forget whether or not they took their medication and then they took it again, well, there you go. It's a low pulse. Or maybe it's digoxin. Did you know that digoxin is one of the #1 medications for adverse reactions? So maybe it's digoxin. Whatever it is, just remember the golden rule. Assess the patient first. Do they have palpitations? Are they, do they look pale to you? Are they complaining of shortness of breath? Are they saying that they're feeling dizzy and felt like they could even faint? Are they a little bit anxious about it? Do they feel some kind of way? Are they exhausted, tired? Do they say it's been getting worse over the hours or even like since yesterday? Are they short of breath? You know, again, are they perfusing blood? You know, blood perfusing. Is their blood pressure low? So if their heart rate's less than 60 and their blood pressure's less than 90/50 and all the other rest of it goes with it, well, let's get ready to treat our patient.